Social media.
Where's your camera guy at?
You know, I fired it. Just kidding. Well, so I assume everybody here is actually pretty hip on running and biomechanics, correct? Yes? So the analysis that you guys do, I just kind of want to show you how important it is to make sure someone is in the proper shoe or the proper orthotic. Because there's so many issues that can be caused if someone has a gait abnormality and they're out there running. Every single step they take is causing a chain reaction all the way up to the pelvis, spine, all that fun stuff. As chiropractors, our main job is the spine, right? So, but it all starts where? At the feet. So, that's why this is called biomechanics and the gait cycle. And we'll go over a lot of fun stuff here. So today's agenda. What is biomechanics? What is the gait cycle? How does any of this pertain to me? How to identify gait abnormalities and their effects, and how to correct gait abnormalities and prevent degenerative conditions to your ankles, knees, hips, and spine. So this should be pretty informative, I think. Especially if you guys have any questions on arthritis or knee degeneration, all that fun stuff. So biomechanics, big word. It's the study of mechanical laws relating to the movement or structure of living organisms. So laws refer to laws of physics, right? And what do we know about laws? You can't break them. So it doesn't matter how strong you think you are, or how far you can run, or how many marathons you've done. If you have a gait abnormality and you don't fix it, doesn't matter. One day the laws of physics will catch up to you. Knee degeneration, arthritis, hip degeneration, ankle degeneration. We're talking bad stuff that will put you down for good, or cause you to need a hip or knee replacement in the future. And my job is to make sure that doesn't happen to you guys, but also to the people that you do your analysis on. So, what this means for you is, your bones are made for weight distribution. That's what the bones are for, is to distribute weight. If you alter their ideal position, it alters how those bones hold weight, which will then cause uneven weight distribution, which leads to wear and tear. Wear and tear is what we call arthritis. Now, arthritis itself just means joint pain. So you've got to be specific sometimes when you talk about that. So, the gait cycle. Now, with your guys' machine over here, I know you do a pretty good analysis. So I just want to give you a little subsidization here of kind of what we're looking at. And so we know about heel strike and toe off and the swing phase, all that fun stuff. So, but it's a motion, and one thing goes wrong and the entire cycle is disrupted. So only it just takes one thing to mess up the entire cycle. So even though there's so many phases to this, but one thing will mess the whole thing up. So, heel strike, loading response, mid stance, terminal stance, pre-swing, initial mid-swing, terminal swing. Don't really need to worry about all that fun stuff. You need to worry about the foot strike. How does the foot strike? Is the weight distribution ideal? That's the big thing. If you can make sure their foot strike is proper and the load distribution is where it needs to be, pronation is the key. So, I brought my little friend here. So I don't know if you guys, I'm going to move a couple of these chairs just so you can see what this looks like. And we're going to go over a couple extra things here in a minute. But, so, foot strike. I don't know if you guys in the back can see. Maybe you don't want to. So, foot strike. Heel strikes here. Foot comes down and through, knee flexes. Pronation occurs when the arch actually takes weight and the knee flexes and the weight is supported. This whole action is pronation. If the arch is not supported correctly, you have this. Now, does anybody know what the normal arch drop should be in an average human being?
2 millimeters.
What?
2 millimeters.
3. 3. So it can go up to 3 millimeters. That's normal. Do you know how small 3 millimeters is? It's like that. So that's what your arch should drop. Most patients, you're looking at least anywhere from 6 to 15 millimeter drop. Anything above 9 millimeters is considered pathological. So meaning that anything above 9 millimeter drop and that system cannot be supported long term. If you have a client that has a 9 millimeter drop, that will eventually lead to medial knee degeneration and a new hip and knee one day. You look no way around that. That is a finite fact. If you do not support that arch, that patient or that client of yours will need a new hip or knee in their future. It doesn't matter if they're a runner or not, because the weight distribution, as that weight is distributed unevenly, it will start that wear and tear from the time they're 10 years old or what have you. So, let's talk about foot strike. So, and I've got a much prettier picture than this. This is something I kind of did up on my own. So, when you have a heel strike, boom, weight is taken on the heel, it's distributed on what's called the lateral arch first. Then it comes over through the transverse arch, and then the weight is distributed again here, through toe off, and over through the subsequent toes, in order. So this is the path the weight takes. But if it's not distributed correctly, then you're going to have foot pains and problems. So you have to make sure, when you're looking at a pressure graph, this is what it should look like. This is a normal pressure graph. Do you guys do this here? No? That's okay, you don't have to. These machines are super fancy, but you don't need them. You don't need them, and I'll show you why. And I'll show you how to make sure your patients or clients have this proper graph without it. And in order to do that, we're going to talk about abnormalities. And this is the stuff that you guys do look at. So, again, these are different pathologies of the foot that you can read through pressure graphs. And again, you don't need this stuff in order to properly diagnose a gait abnormality. You just don't need this. What you need is your eyes. And the fancy machines do help. So, here's what we're looking for. This is a neutral angle as far as a heel strike goes. And this is what you guys can look at with the machines. So, when you have a negative or a positive angle on the heel strike, and again, the takeoff, so toe off, you know you've got a problem. So for instance, on this guy, if you have this negative angle, you're going to have a lot of problems. And this is something similar to overpronation. So, where'd my foot go again? So, with your leg, again, if you have an overpronator, this is what their strike is going to look like. And this creates what's called a Q angle. And we're going to go over that here in a minute. So the Q angle eventually will cause an ACL issue, but also as that overpronation happens, it changes everything all the way to toe off. So you have to support the arch. Everything is about the arch. So we'll go back over Mr. Bones here in a minute. So again, here are some overpronations and underpronations. Underpronation is called supination. Only 5% of individuals are supinators. Very, very rare. But 95% of all gait abnormalities start with overpronation, which is that knee coming in. So that's what you really have to worry about. If you have a true supinator, if you have a really true supinator, they're rare and very difficult to deal with. But 95% of the people you're going to encounter are pronators, overpronators. So again, heel strike, and then we have weight going through the transverse arch, lateral arch, and then transverse arch and toe off. So with overpronation, again, notice the angle. The angle. Even though their heel strike is normal, the angles become too acute to support long term. So how does this pertain to me? So what are the symptoms of a gait abnormality? Do I have a gait abnormality? Am I at risk for degenerative conditions? And if you have a gait abnormality, the answer to that last question is Yes, you cannot trick the laws of physics. No matter what you do, you cannot change them. So if you have a gait abnormality and you don't fix it, you are in big trouble long term. So, symptoms of gait abnormality. Uneven shoe wear. Has anybody ever looked at the bottom of your shoe? Right? You can read a shoe like you read a book. I have patients come in my office and I don't even want to, I just, let me see your shoes. Because if you look at the shoe wear, I can tell you exactly what their problem is. If they're a supinator or a pronator, or where their toe off is. So sometimes you want to see that toe, you want to see that wear on the big toe portion if they have a proper toe off. And the heel stripe should be just outside of center. So you need to see that wear. And again, as shoes wear, they're like car tires. You can't have the same pair of shoes for 10 years. You have to have good tread on the shoe. Because once the tread starts to wear unevenly, then it just helps it furthers that issue. It compounds it, makes it snowball. So, pain in the ankle, knee, hip, or low back. These are all symptoms, not saying you have to have those to have a gait abnormality. And if you have those, it doesn't mean you have a gait abnormality, but these are things that you might see. Frequent ankle sprains and strains. So again, with that overpronation, that internal angle on the foot, it makes you very prone to an ankle sprain or strain because the biomechanics aren't there. The stability's gone. Plantar fasciitis. Come on. Everybody's seen somebody in here with that, I'm sure. And then degenerative conditions in the hip, knee, or ankle, runner's knee, stress fractures in the foot, all that fun stuff. Again, shoe wear is very important. This is a very crude chart. Again, what you want to see is the heel strike should be just outside of the heel, right down here. Then you want to see some wear coming up through here, coming over, and then you want to see a good wear pattern here on the big toe. So that's what you want to see. That is the absolute perfect shoe pattern, if that's what you're looking for. Now, so medial wear, so the internal, that's going to show us overpronation, and again, much more rare is the supination.